this meeting is personally dedicated to Dr. Merlin T Miller, Chicago, who is a mentor of Dr. P. Vijayalakshmi ma'am. So now the program is starting with Dr. Vijayalakshmi madam's talk on overview of visual impairment.
Again, a very good morning to all of you. And at the outset, I welcome Mr. Narasimhan from Vision Aid, Vijay Francis from Vision Aid, Ramu Muttangi, and all our colleagues and partners from around, and our esteemed speaker from outside, from LV Prasad, today, Dr. Deepak, who is a well-renowned optometrist, who is very well experienced in teaching, especially on opticals and electronics in rehabilitating visually impaired people. And all the organizations which were invited by me, and also organization invited by Vision Aid, you are a warm welcome from all of us from Aravind Eye Care System, Madurai. So I thought maybe to start with, the program goes like this. Start with, we will have an overview, and then Dr. Sagitya will present what we have been doing earlier and what are the improvements that we have made with an association of Vision Aid. This is mainly for associations and organizations which are participating here to know about what we can do or what we can achieve by working with an NGO with an equal or same mission of giving services to other people. So in the this context, so we will, and after that we will demonstrate in detail about the SVG spectacles, starting from scratch to what we are now. So that is what the program is going to be. So let me start this with my small presentation. This dedication to Dr. Merlin T Miller mainly because she was the mentor for me. From the beginning, 1982, I did a fellowship in Chicago in pediatric ophthalmology, and she was there as a teacher. And from that time onwards, she had visited me at least 20 times, almost every year to Madurai. Still she was able to do on all occasions, and was responsible for me to grow hand in hand with her. She used to say that she was able to achieve things more through me rather than in her institute. So I was one of the favorite students of her, and apart from that, she also distributed pediatric ophthalmology to other parts of the country. ROP, when I say anything I want to learn, she is there to send people. And vision rehabilitation, she is there to send people. So through that only, we had Dr. Linda from USA. She is 5 years ago, and with her only we got more refined in rehabilitating children. And with Vision Aid, we got refined in rehabilitating adults. So I feel so happy to dedicate, she just passed away a few months ago. So I just feel so happy to dedicate this to her on this occasion. So now coming to the subject, we all feel, most of us at least feel, the eyes are only responsible for seeing. It is not so. It is the brain mainly. Just the intact eyes may not be enough for us to see visual processing. So we need to know so much while we think about rehabilitating these people, those who are blind or visually impaired. Not only about the eyes, about their processing in the brain, about how they are what areas they are not good, select those areas and then try to rehabilitate them. That is the concept that we have now. So what is vision rehabilitation? It is an effort of assisting those with various degrees of vision loss and making them cope with its consequences in daily life. Not in daily, apart from making them good in education and also facilitate them to have a good placement. This is rehabilitation or habilitation what we mean. And traditionally, this was focused only on optical devices. When I was young, say early 80s, mainly we used to give only magnifiers and telescopes. That is what we know. When we say low vision aids, we knew only those two. So it was only to enhance them with the vision, whatever they have, to use it. That was not, now there is a totally different concept. Yes. By treating, if we want to restore, if we can restore the vision, restore it completely. But what comes when you are not able to treat and then get back the normal vision what we expect? That is where we are. When the tumbler is half filled, we just know with the half filled tumbler what best that you can make use of that water, whatever we have. So that is what the rehabilitation concept now, to enhance the vision what they have already. So this success depends upon the people to identify, because it's totally different when you have a congenital and acquired. People, those who are born with good vision and losing it suddenly, have very bad impact on their life. And then if there is associated disabilities like physical or mental, and also what exactly they need for their own life, that should be known. It is not good if some people, a retired person wants only to read, you don't have to teach them a computer. So you don't have to teach them on other telescopes, but he wants to see, read, and then he wants to identify some people standing in front of him. That is what his core is. So identify what exactly their need is, and then if you go towards that, definitely we can satisfy them to a level what they need, and it is more important. We should not force them to use what we have, but we should find out what exactly they need and then go with them. So why we should be talking about it? If you know, this is data from India. I got it in 2010. The prevalence of vision impairment among all ages is 1.05%. If you come to the important or a significant age group, that is 5 to 15 years old, it's about 2.5 per 1,000 population. See the impact of it. And that population is the one we need to concentrate. And right now, this data, what about they say 320,000 children blind, another threefold are visually impaired, must be more now. This was a quite earlier data. But the data says among these 320,000 children and another 800,000 children, only 20,000 children are getting a good education. So the gap, you see the gap between the numbers, what are there in the population and what are being curtailed in services. That is where that we need to go in and then do what possible by us. Why this is the situation? The reasons are many. Many are not utilizing services, mostly because of a lack of awareness or a lack of professional advice. That is mainly because even people in the field of ophthalmology don't know about what is happening currently in the vision rehabilitation. So our duty now goes to spreading the news to our fellow beings to make this possible to other people.
Yes.
This is a small example. So children with vision impairment, a patient is having. The parents, they don't know what exactly to do, are confused to know where to go. And then somebody told something, so they are trying whatever is possible, a special school or therapy. Usually they go for all occupational therapy, speech therapy, physical therapy, everything. But the vision therapy, they are not given very much importance. So what happens after some time, they realize somebody has told to go to an ophthalmologist or a pediatrician. So when they go to a doctor, after being examined by all the investigations, then they say, go to a special consultant, ophthalmologist. Ophthalmologist himself says, your eyes are perfectly all right. I don't have anything to offer you. So still they are confused. They don't know what exactly to do. So this is the situation here. So how to break that situation? How do we act to break this situation, to make more children and young adults to get used to this kind of rehabilitation rather than focusing on 80-year-old. So even though this is also very important. So why this is happening is, again, parents think child is too small, or vision impaired children should be protected. The vision whatever they have should be used very restrictively, otherwise the eyes will become bad, or the disability will be shown more outside. So the present situation about the ophthalmic care is, we have very good institutes, tertiary, secondary, primary, to cater services for all diseases in the eye which are treatable. Best ophthalmology has developed very well in our country. And there are also organizations for rehabilitating the children with blindness. You know, there is Indian Association for Blindness. There are so many associations running schools for the blind. But the category between these two, where they have some vision but not a good vision to cope up with the daily life, those people are left with. So our focus should be mainly on this group from half by 60 to 624, where they are not able to do their job independently. The reasons are so many. All of us know that affordability and accessibility and the availability of trained professionals. So for the affordability, I think we have more and more NGOs like Vision Aid, like RAM SAG Technologies, Trees for Life, Rotary clubs, all those people are now ready to come. This accessibility, how do we access the people, those who are in the community? That is the big challenge now for us. So we have to strive on working how to access or how to facilitate the accessibility by these people. And with that, we also should equip ourselves, those who are trained in good professionally. How do we cater services? How do we counsel these people to accept the rehabilitative services, whatever is available? How to make them uplift in their life? So, come to the end, our responsibilities should be equip ourselves with the current knowledge, whatever is available in the country or in the world in this field, and that develop a strategy for early identification. Doesn't mean early age, but early identification means the time they lose the vision or the time they are going to lose the vision, how do we identify them early? And recognize the progression or static of the diseases. What should be our advice on depending upon the progressiveness of the device, and create awareness among our own fellow optometrists, ophthalmologists, neonatologists, pediatricians and neurologists. And then to take this service to the unreached. And this is not going to be very easy just by sitting in one place and then waiting for the persons to come. So there must be a team approach, which should be anybody, NGOs, professionals, or other rehabilitative persons in the in and around. So if that could happen, if we can all join hands with the organizations with the equal and good mission, definitely we can achieve those things possible, whatever I mentioned earlier. And this is what you see Merlin as. She was responsible to name my institute as Pediatric Ophthalmology. Earlier it was used to call as Squint Clinic. And that Sitapur, Megre was main source, I think, to have squint as a specialty. And then there are strabismologists taking care of squint only. but she made to name this clinic as pediatric ophthalmology, catering services to all children, whatever their problems were. And that is where my passion has become. Yes, I have been able to do treatment for all these children, those who are being treated. But I do see so many children with other diseases or born with vision impairment where I cannot do anything surgically or medically. So what should we doing? That is how all these things happened, and I am very happy that we are at this stage, but this is not going to be the end. Still, we need to go further, and I do hope with the guidance of all of us, our founders, the heaven will, with their blessings, we will be able to do much more. And I expect all the other institutes, those who are here in our discussion, should go further and then equip themselves to do a much better service. Thank you very much for your attention.